Hi, this is Dr. Saxena, and we'll just talk about something on the terms of what exactly is this called vaccination. And it is also known as inoculation, and it's a orthodox medical usage of vaccination is based on the premise. Vaccination involves the use of vaccines to stimulate the formation of appropriate antibodies against the specific bacterial or viral infection. So, usually the kind of procedures vaccination is often administered in 2 or 3 stages, as separate doses are likely to minimize unpleasant side effects. Vaccination is usually administered by injection, although oral vaccines are also available for some diseases. And now we are trying to work on there is something called intranasal vaccination. Um, what is this thing called active vaccination and passive vaccination? Active vaccination involves administration of antigens to a host individual in order to induce the formation of antibodies. And when you form the antibodies, and that by that you introduce into the cell-mediated immunity. Active vaccination involves the use of either inactivated, which is killed material, or live attenuated, which is a variant and mutant material. Passive vaccination involves the transfer of immunity to a host individual using preformed animal or human antibodies, which are usually immunoglobulins. So, on that kind of background, I can always add some things here, which I always believe. What are the substances which enhance the function of vaccines? There is a thing which we need to understand. Before that, I would like to look into what are the toxic effects of vaccine. These days, everyone is talking about what are the toxic effects. The negative side effects of vaccines are widely debated. It should be emphasized that the area of vaccine toxicity internationally has been subjected to very little scientific research. This means that in the absence of controlled scientific studies, the anecdotal accounts of individuals carry somewhat more weight than usual. Assuming that these anecdotal accounts are valid, the safety of vaccines, especially multiple vaccines in given at a particular time, particularly when you talk about pediatric age group, and becomes very questionable. What happens, what we are trying to work it out is there are a lot of additives in the vaccine which has the potential to create more toxic effects. But the most common thing which we look into is something like formaldehyde, which is added. Formaldehyde is normally added in a mortuary to keep the it's used mostly in the mortuary to preserve the human body, and we had when we went into medical college, we used to inhale formaldehyde because that days we used to have that during our anatomy dissection days, we used to have that particular thing. All this kind of dead bodies are being properly immersed in formalin, and we used to do some dissection and all that. Yes, this is the formaldehyde. The same formaldehyde is used in vaccine to probably that is one of the bigger takes. I certainly I have to see that these are the things which are really causing some nasty. Along with that, you have got something like aluminum and mercury derivatives, which contribute to other toxic effects in this particular thing. Usually, we are talking about some things which we believe can help these things to not because now we believe that it is it's very important to have to vaccinate ourselves, and once you take a vaccine, you can always take a herd immunity and all that. But at the same time, what are the things which can help in the effectiveness of the vaccine, and which can help your body, which can help you not getting into some side effects, some kind of things, nasty things which have been reported. So I would definitely prefer everyone to take something like melatonin, which increase the effectiveness vaccines. At the same time, melatonin is such a good antioxidant. It preserves, it tries to, if at all there is some negative side effects and all that which are happening because of this antigenic, huge antigenic stimuli, melatonin can effectively, along with that we try to ask people to take a lot of vitamin C, oral stuff, along with that vitamin D and all that. So the basis here is to prepare yourself. You should be, you prepare yourself for the vaccine. Just don't just go and take vaccine on one particular email. Before that, start doing homework before 1 week. Start taking melatonin, start taking good supplements, start taking good diet. Then you subject yourselves for vaccination. After that also, things are not yet over. We would like you to take for 1 week to 2 weeks. Continue the process what I have been emphasizing. It will help you in a big way, and this is how you can always improve on the antibody formation, and how antibodies can be it helps the body. See, after all, we are trying to, when we do vaccination, we are trying to do this immunization, we are trying to improve the antibody formation. And if you are properly done your homework, trying to work on this good diet and good kind of stuffs and all that, you're probably, the antibody formation will be good, and you will be you will come out quite normally. You will not get into any major problems, which I believe, I think this is the thing which I just want to convey for every person who is contemplating to go for and taking vaccination. Thank you.